Tonight at 11, we know our roads here in Florida can be dangerous. More than 2,800 people died in crashes on Florida roadways just last year. But there could be a new way to save about 35% of those crash victims. Fox 13's Genevieve Curtis tells us about the federal initiative and the money awarded to Tampa to try and do just that.
When first responders get to the scene of a crash, they take every step possible to save a patient's life before they arrive at an ER where doctors like Andrew Thomas are waiting.
You have a lot of people that are working together in a very orchestrated fashion.
There's an emerging tool that could soon give patients in Tampa a better chance of surviving a crash. It's called pre-hospital blood transfusion, and data shows giving blood to a trauma patient in the field can reduce deaths by 37%. I spoke with the National Highway Traffic Safety Administrator Jonathan Morrison in D.C. He says this is modeled after lessons learned from trauma care in Iraq and Afghanistan.
We are facing an ongoing crisis in traffic fatalities. Every year we have about 40,000 fatalities on our roads. But we're trying to take efforts to really bring these numbers down. And I think one of the more creative approaches in doing so is focusing on post-crash care.
The National Highway Traffic Safety Administration granted $50 million in funding to help 25 communities across the country equip EMS and paramedic teams with the tools and training to do these blood transfusions. It awarded the city of Tampa's fire department $1.4 million. It is the only community in Florida to be included in this grant program.
So looking at traffic fatality rates in Tampa, the way the geography is set up, this looks like it's a program that could really help.
It's not a new concept, but one that very few agencies have been able to set up.
We've got about 15,000 EMS agencies across the country. Only about 2% have such programs. So we're leaning in. We're taking a look at the successes in those programs and looking to expand that.
According to the NHTSA, severe blood loss is the leading cause of preventable deaths in trauma care. Nearly half of patients die before they reach the hospital.
It can be very frustrating knowing that someone was just one step away from being salvageable.
Dr. Thomas has been involved in getting this program up and running in Tampa. They hope later this month. He believes it will make a difference for the patients coming to them.
We've seen our colleagues in other agencies across the country utilizing blood in the pre-hospital setting, and they get these cases of good saves, heroic saves or benefits. And so we're hoping to bring that same advanced, service here to our patients in Tampa.
And the administrator told me this is a 5-year program, so they're going to monitor the success of the grant and also areas for improvement. But they hope this will be a model for other communities across the country. I did reach out to the city of Tampa and the fire department. They said they're going to wait to comment until the grant is finalized. Reporting in Tampa, Genevieve Curtis, Fox 13 News.